They're calling for staffing mandates in hospitals. Nurses from all over PA gathering on the Capitol steps today, rallying for the Senate to pass a bill that would require a minimum patient-to-staff ratio. Thanks for being here at 5 o'clock. I'm Joel D. Smith. CBS 21's Elise Person was there at that rally, joins us now from the Capitol with why the nurses say the passage is so needed. And even if it is, are there enough nurses to do it? Elise.
Well, Joel D., it's called the Patient Safety Act. It's a bill that would require a minimum patient-to-staff ratio in Pennsylvania hospitals. And one nurse today even tells me that right now in Pennsylvania hospital systems, patients are slipping through the cracks because of insufficient staffing.
What do we need?
Safe staffing!
When do we want it?
Now!
We don't feel safe practicing this way.
Hospital nurses across Pennsylvania are looking to get what they feel is more appropriate staffing.
We need ratios in place. You know, an ICU nurse should only have 1 or 2 patients at a time, depending on how critical they are. We are routinely taking 3 patients at a time.
Data from the Hospital and Health System Association of Pennsylvania shows registered nurse vacancy rates in PA are sitting at 31%. Some say high workloads are leading to turnover in the nursing field.
Nurses continue to face moral injury, exhaustion, burnout, and are leaving the bedside or are leaving the nursing profession altogether.
The nurses say the impact of staffing doesn't just impact retention. UPMC Altoona nurse Jamie Balsamo says patients are falling through the cracks.
The patients and families go too long of a time without being seen by their nurse. If there's something going on in one room and we get preoccupied for a while, there's just not enough time to divide fairly between the patients and make sure they're getting the adequate care that they need.
The Patient Safety Act passed the House floor in June with bipartisan support. The bill calls for mandatory staffing minimums dependent on the department or unit. Now, the bill waits for the Senate to vote.
While we wait, patients are losing their lives. Research has shown that passage of the Patient Safety Act will save 1,155 lives in Pennsylvania hospitals every year on med-surg units alone. We can't lose those people.
In a statement to CBS 21 News regarding the Patient Safety Act, Penn State Health Hershey Medical Center's chief nursing officer says, quote, mandating ratios does not solve the shortage issues or produce more nurses or other health professionals to care for Pennsylvanians. If the Patient Safety Act is passed, the impact will be negative for Pennsylvania patients and healthcare systems' ability to deliver the care people need. Again, that bill is currently sitting in the Senate, and as of right now, I'm told there's not a date set for when they may or may not vote on that. Live in Harrisburg, Elise Person, CBS 21 News.